Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. And so today I have a couple guests with me here in the studio, and then I have Kit Blair joining me. So Samantha, do you want to quickly introduce yourself, and then Morgan, you as well?
Hi, my name is Samantha Addis. I am the office manager at Revitalize MD. So I work really closely with Dr. Durst as she creates these custom treatment plans for women regarding Votiva and the O-Shot. So
my name is Morgan Lau. I am the Director of Business Development. I also work very closely with Dr. Durst and Samantha. Kind of do more behind the scenes financing.
Which is the harder part, behind the scenes, keeping us all in line. All right. So basically today we have a guest on the podcast. It is Kit Blair with InMode. And so he's going to be on talking mostly about Votiva. Who knows? We might come up with, a couple other pieces of information on the other devices that are wonderful as well. But welcome, Kit. Why don't you go ahead and introduce yourself and tell us a little bit about you?
Thank you. It's a pleasure. Thank you for having me on here. My name's Kit Blair. I'm the senior district manager for InMode. I help manage the Southeast sales team, the DC, Maryland, Virginia, West Virginia sales team for the company. And I also specialize in surgical sales training as well for the entire company. So been with InMode now for a little bit over 5 years. I helped introduce really the world's first energy-based intravaginal treatment for women's health, which was a fractional laser from years ago. So I've had really a finger on the pulse of the industry ever since its inception. So happy to be here, happy to share some information.
Awesome. What year was the first device put on the market?
I believe it was 2013.
Okay. All right.
Yep. 2012, 2013.
And that first one was a fractional ablative?
It was a fractional ablative laser, correct.
Okay.
And it was really all stemming from what physicians and scientists saw the physiologic reaction, or the reaction of the skin to a laser. I mean, it caused a significant healing process after burning the skin on the face and on the body. And so they, equivalated that to utilizing it intravaginally to help heal the tissue that becomes dormant or lax over time. And come to find out that that vaginal tissue, the mucosa tissue, which is comprised of the same kind of tissue like our gums are comprised of, it actually reacts a lot better as compared to the skin, the epidermis on our body. It's just so enriched in water that it definitely reacts way better to an energy-based therapy as compared to any other type of tissue on the human anatomy.
That was an ablative device, and there's still some ablative devices, and we'll talk a little bit about the differences between ablative and non-ablative. But so I didn't even know what year they started doing vaginal rejuvenation with lasers. So 2013, I'm sure the devices have changed quite a bit since then, and you have probably seen that.
They have.
And so basically where we are, and, Kit, again, came in with, we do a lot of sexual wellness, at Revitalize MD. I had been looking at lasers for aesthetic reasons, and then also a different laser, and then Kit and Victor brought in the machines so that I could see them in action. And so Votiva is the machine that I chose to go with, and we have had just amazing results with Votiva. And so if you want to talk a little bit about Votiva and the specific treatments, the girls will have some questions, because a lot of times patients are asking some things specifically when they call, and then I'll give you some feedback of what our patients have been experiencing with those amazing results.
I think just to understand what happens, the degradation of tissue after, menopause starts to kick in, or breast cancer survivors that are kind of put into an onset state of menopause at a younger age because of, taking away the circulating estrogen that's happening in the human body. And even patients that, might be 25 years old, had 2 or 3 children, and have experienced a lot of trauma to the pelvic floor musculature in the foundation. All of a sudden they start causing leaking when they cough and sneeze. And so that's really a very broad spectrum of women that suffer from, can be debilitating conditions with sexual wellness, sexual dysfunction, and even, of course, urinary incontinence and laxity. And it's something that's very prolific and has been, kind of hush hush for many years. And really, before these energy-based therapies, there was only Kegel's exercises, pelvic floor therapy or surgery. And there's a huge gap in that spectrum of patients. And a lot of patients, it's very difficult to stay compliant with pelvic floor therapy, very difficult to stay compliant with hormone replacement therapy, especially topically introduced hormone replacement therapy that's done at home. And then a lot of patients don't want surgery. There's a lot of risks and complications, associated with pelvic slings. I believe vaginal mesh is completely out the window now as far as a surgical procedure because of the complication rate with those things. So there's just this untapped, patient base that has not had many answers to their issues of laxity, sexual dysfunction, and sexual dysfunction can range from everything from painful intercourse because of lacking of lubrication or because of lacking of the pliability of the tissue. Once the vaginal or once the circulating estrogen starts to slow down at menopause or from other hormonal issues, then that vaginal tissue, that mucosa tissue, is very dependent upon that circulating estrogen to produce everything that maintains the ecosystem in the vaginal canal, everything from the lubrication, which is called glycogen, which it keeps the healthy gut bacteria compliant and in the vaginal tissue. So once the lubrication goes away for whatever reasons, hormonal or physiologic, then it starts to cause a whole host of issues. And once that circulating estrogen goes away, it starts to cause a whole host of issues, and the pliability goes away, and the blood supply goes away from the tissue. And so your patients are left with tissue that doesn't bend or flex anymore, and it's more you can get micro tearing and painful intercourse and sexual dysfunction because of the lacking of blood flow. And that's blood is the nutrients of life. And so what we saw with previous technologies is when you cause an injury to tissue, it causes a healing response, which is blood flow increased to the area. And so the first generation of those devices, the lasers, its main target with these lasers were water, and in this water enriched environment, the vaginal tissue, the laser would hit the tissue and evaporate some of the superficial tissue and cause some superficial regeneration of the skin. And then, of course, with the evolution in science and in testing, clinical studies and data, scientists and doctors found out that you don't necessarily need to burn the tissue to cause that same physiologic change, that same reaction, that same healing mechanism. And so the best and really the most used form of energy in medicine is radio frequency. It's far more controlled as compared to a laser, because with a laser, you can shoot a laser across the room and blind somebody on accident. It's a very powerful device and it burns skin. With radio frequency, you can cause bulk heating that actually, with the thermally induced bulk heating, it can reach the temperatures, the increased temperatures way deeper to the tissue than a laser can. And it's far more uniform and controlled and safe. And with InMode as a company, I mean, we are one of the few publicly traded companies in this space. The call sign on NASDAQ is INMD. Our stock grew over 250% during the year of the pandemic because we're compared to Apple and Tesla as an innovative medical technology company. All of our technology has been developed in-house. We do not buy third-party companies for technology. So everything has been created in-house, and we are the radio frequency kings, the leaders in the industry. We have our chief technological officer has over 40 different patents in bipolar continuous loop radio frequency. And it's, with radio frequency being the mainstay of medicine, it only makes sense that we would utilize radio frequency in an intravaginal approach as well. So through years of research and development, InMode created Votiva, and it's the world's first on-label, therapeutically indicated intravaginal device that's energy-based, that was actually manufactured for its intended purpose of these therapeutic treatments of women's health, whether it be sexual dysfunction, whether it be painful intercourse, whether it be orgasmic dysfunction, whether, really it ranges everything from sexual dysfunction to incontinence. So it's really the next generation. It really takes things to the edge of what providers can do with an energy-based treatment. And now it's available in your office, Dr. Durst, to be able to change the lives of patients. And it's truly the technology that that I like the most because it's such a life-changing therapy for patients and for couples.
And they finally can get some solutions. So, again, when we talk about young and healthy, childbearing years, when women are young and healthy and haven't had children, our vaginal canal is set up to take a lot of insult, and, our pH and osmolarity will accept a lot of different things. And then as we had children, we get changes just with that alone, just the weight of a pregnancy and vaginal delivery. There's a lot of damage, again, a lot of obliteration of tissue that normally is healthy, right? Again, children take a toll on women, and we love them, but there's some changes that happen. So even before hormonal changes, they'll come in just for urinary incontinence, which is what you were speaking of. Again, I'm jumping on the trampoline. I've had a couple vaginal deliveries. They're not menopausal. They're not even perimenopausal at times, but they, can't jump on the trampoline with their young children now without some urinary incontinence, some stress urinary incontinence. So again, that alone will bring them in. And again, with this Votiva treatment, it's amazing how you can see tightening and healthier tissue just with one treatment. But always a series of 3, and the improvement in urinary incontinence just with even those premenopausal women is amazing. And then again, you were talking about, then you can talk about perimenopause and menopause and those hormonal changes, add a whole nother dimension to vaginal changes, so that now all of a sudden they're not lubricated like they were. You're right. They're dry. And so as these devices, and then this is where you can talk more about Votiva specifically, it's heating the entire vaginal canal, causing collagen elastin stimulation. So you have healthier tissue. It gets tighter. You also increase blood vessels and nerves. So you have increased lubrication, because lubrication is a function of blood flow. So if we're increasing blood flow with, an RF device or heating device, then you're going to have increased lubrication, and so less pain, healthier tissue. And then what I love about Votiva is I can focus it into where their issues are. So if maybe it's not complete laxity that they're talking about, but orgasmic strength that changes with time, or urinary incontinence, we can focus it in on the anterior vaginal wall or G-spot area to increase, again, heating and that injury pattern to get better healing in that specific area, which is their area of concern.
Yeah, absolutely. And from your specialty, from both the clinical side and from the aesthetic side, when you're not doing fully, invasive surgical procedures, whether it be cosmetic or women's health or medical, it takes combination therapies, combination treatments to yield the most dramatic end results. And I know that you really cover the entire spectrum of sexual function and women's health, pelvic therapy, everything, cognitive health, to be able to cover that entire spectrum. So, the injections, whether it be, the O shot, P shot, that kind of stuff has gone a long way and evolved over time. And, PRP, things like that. So definitely the combination of Votiva and with other things can Votiva alone is life-changing and game-changing, but the combination of those can just bring back an incredible quality of life for a lot of patients, for sure.
Yeah, a lot of patients. And I always say, once we cut on people, so again, when people ask whether something's FDA approved, that's a frequent question. And so, because again, there's been some controversy with vaginal rejuvenation, right? And I think a lot of it's strictly an unknown thing. So there were some devices that were on market just for that. And then the FDA came out with some warnings. And again, most of those were ablative. And so again, causing some tissue heating to a level that we're not heating with Votiva and RF.
The great thing is that at the end of the day, Votiva from InMode is the only device that's actually registered as a pelvic floor therapy device. Everything else has been completely off-label, including the devices that I helped bring to market years ago. Although we knew that they worked exceptionally well, there were risks involved when you're burning tissue intravaginally or anywhere on the body. And then also the superficial depth of penetration with the laser, it really didn't go nearly deep enough to cause any kind of change in the pelvic floor. It was really just for superficial, laxity and dormancy and lubrication. So with Votiva, it's, everything else has been first generation, second generation. Votiva is the third generation device, and it's the only one that's indicated as an intravaginal therapy. It's also the only one that's registered as a traditional pelvic floor therapy device. So it's taking things to the edge of what providers can do, because it's utilizing continuous loop bipolar radio frequency to go down to about 4,500 microns or 4.5 millimeters. It's the only technology that's clinically proven to not only cause that same physiologic change superficially like the old devices, but it actually causes new blood vessel proliferation in the middle line of the tissue, which is called the lamina propria, and then all the way down into the musculature, which is what controls the function of the pelvic floor being able to squeeze the bladder and also cut off urine. So essentially, it's the only device that's able to treat internal structures and external structures. And I know Dr. Durst is probably going to talk about that as well from the visual, the cosmetic side of things. So it's able to treat internally and externally to improve the function and the cosmetic side of things. And then it also is the only device that's proven to go into all three layers of the tissue: the epithelium, which is the outer layer; the lamina propria, which is the middle layer; and then the musculature, which is the muscle layer. So it's by far and away the device that covers the entire spectrum of services for women's health.
And so when you're talking about the pelvic floor, you're talking about the muscular pelvic floor and the fact that we can get to that level with Votiva.
Correct.
Okay. Because even I don't talk probably enough about that in the office. We talk a lot about, it's heating overall and, increasing blood flow and nerve fibers, but not even, just pelvic floor support of that, urethra at even a different level.
Right. So, and we actually came out with a quantitative peer-reviewed study that they actually use a device called Urostim, which is it's a device that measures the pelvic floor's ability to contract. And at a normal patient, I believe it's around 0.24 millijoules and as a response rate. And then, a patient suffering from significant incontinence, it's almost down to 0 or 0.05. And so after, 8 weeks of follow up after one single Votiva treatment, they saw, an increase almost back to normalcy as far as the pelvic floor's ability to contract and accept the electrical stimulation from the brain, because of course you have to have a lot of blood flow and circulation in the nerves to be able to accept the electrical stimulation from the brain, telling those nerves to contract the pelvic floor. So with this enriched blood flow and, new nerve endings and new tissue growth and new collagen and elastin growth, the pelvic floor has the ability, that musculature has the ability to accept that electrical stimulation far better. And then there's another study that shows that 10 weeks after one Votiva treatment, after a series of Votiva treatments, 10 weeks follow-up yields the same as 10 weeks of traditional pelvic floor therapy 3 times a week. So, it's basically the ability to ensure results for these patients that are suffering, and they don't have to go through a ton of work to try to yield those results.
And we've known about Kegels forever, right? And so women still come with that complaint of urinary incontinence. So it doesn't seem to work. And maybe that's exactly the reason why, is because we don't have enough healthy, communication and blood flow to those pelvic muscles for them to actually get the contraction and the response rate that they want to.
Absolutely. And the thing is that, the cornerstone of our company, as I said, is radio frequency and Body Tight, which is, it's a plastic surgery tool. It's what Votiva is derived from, and it's, used around the world for plastic surgery. Now Votiva is the derivative of that. And it's the gold standard now for women's health. And, it's a very quick and easy treatment, which is what's incredible. It's pain-free. It takes usually about 15 minutes to do in the office. There's no discomfort, and patients yield and can feel results right there on the table. And then it continues to improve. And so it's, through a series of 3 treatments, it's really causing changes that no surgery ever could do, because it's increasing a lot of new collagen and improving the quality of the tissue. So there's no surgery and there's no therapy, just normal pelvic floor therapy that would actually dramatically increase collagen, elastin production, and permanent blood flow to the musculature. So it's it does something that no therapy and no surgery ever could do prior to this.
Oh, yeah. And we have those conversations a lot. So again, getting back to that FDA approval, patients will ask me if, these are FDA approved. And I say, well, medications and surgeries are FDA approved, and there's complications, and there's not always a response rate with those. And once we cut on the body, the tissue doesn't function the same way. And so you're never going to regenerate with medications and surgeries. So, but we're not taught in traditional medicine to look for things that regenerates. So the whole the realm of regenerative medicine, again, may not be an FDA focused area for right now, because we're approving medications and surgeries, and there's complications with that. There is not 100% response rate, and you can never regenerate with those. And so these are treatments that you cannot get with medications and surgery and traditional solutions. It just doesn't exist.
And devices are registered, not cleared, so it is registered not only as a traditional pelvic floor therapy device, but with the therapeutic indications for the treatment of sexual dysfunction and pelvic muscle strengthening as an adjunct to Kegels exercises. So it's as cleared and it's as registered in the FDA as possible to be as on label and indicated as possible, which it is. So it's the most on label therapeutically indicated device that's in this industry.
And again, you just can't get these results with medications and surgeries. And once we cut on something, it's never the same.
Correct.
And this is regenerating. So you're basically using heat down to a level that's going to stimulate collagen and elastin and increase blood flow and therefore lubrication. And you're going to increase nerve sensitivity in the area. So it improves urinary incontinence, it improves laxity, it improves tissue health in the area. So again, that acceptance of different, pHs and osmolarities as we get older will be better with it. And then again, that urinary incontinence is huge, but orgasmic strength is a big one for women, and then so you talk about 15 or 20 minutes. So we do a 40-minute treatment. 15 or 20 minutes is on the inside and 15 or 20 minutes is on the outside, but we can refocus on the inside if they want it. Because again, I love the fact that, and again, Votiva is, a favorite treatment of mine, and we do Votivas every day. And I have been doing O shots for years, and I was thrilled to add Votiva to the treatment protocols. And there's very few women that get one without the other, because I really believe in the benefit and how they complement each other. And so on that first Votiva treatment, we're going to do an O shot with the first one, because they're going to get the biggest response and improvement. And so even if they're not convinced of the combination, we have kind of a special offering for them so that they try both of them together, because some will come because they've looked for an O shot, or some will come because they've looked for, vaginal rejuvenation. And so I want them to try them both together, because I can heat the tissue till it's injured, and then dump a bunch of growth factors in there with PRP. So the response rate is amazing, and they usually come back and get the series, even if they were resistant. Most people are not. Most people will get the series up front of Votivas and the O shot. So we'll do 1 O shot and 3 Votivas.
You really do need the series, though, just to ensure that whole building block mechanism of action. I mean, it's the body. We all have what is called heat shock proteins, and they're sitting dormant throughout our entire body, and it is the trigger mechanism for an injury. And when you cause a thermally induced injury from radio frequency, it's all down to science now. If you can sustain 42 degrees Celsius over 15 minutes in one, in an area, then it causes the thermal breakdown of tissue. It triggers the heat shock protein response, which is the healing mechanism for the body. And that's what triggers new collagen production, new blood flow response, new glycogen production, which lowers the vaginal pH. And I don't know, have you seen with patients with recurrent UTI, have you seen a significantly, downward or downcrease of patients that experience that after having the Votiva treatments?
So we definitely do. The issue is they're frequently complaining of urinary frequency, Not necessarily UTI. They'll either say I have frequent urinary tract infections or UTIs, or I just have frequency. So not incontinence, but a frequency. And so again, as your tissue health vaginally is better, your bacteria is better, then again, because of the short urethra with women, we get urinary tract infections because everything's unhealthy down there. And so we don't have the right bacteria and the vaginal health isn't good. So once that all improves, they get improvement in frequency and urinary tract infections. Absolutely.
And that lactobacilli, that's the positive gut bacteria, the flora that's in the vaginal tissue. Once that vaginal tissue starts to become dormant or strained or stressed, that lactobacilli can decrease, which is the number one defense mechanism against UTI. So to be able to bring back the healthiness of the tissue, the increased blood flow, which of course plumpens up the tissue. Like we get collagen is the healer. It's what makes our skin fluffy, and that's why when people get old, their skin becomes deflated and lax because the collagen stops producing after the age of 32 to 35 in humans. It starts to really start to decrease, not completely stop, but it starts to decrease every single year after 35. So you have to cause that micro injury, that thermally induced injury, or some kind of injury to continue to produce collagen and elastin in the tissue. So this is exactly what this technology does: is perfectly and uniformly heat that tissue, not just on the surface, but down deep, through all of the layers, perfectly and uniformly without burning the patient, and then maintains it in a bulk heating format for X amount of time, over 50, anything over 15 minutes, it causes just a ton of new collagen, elastin production, and new blood flow. So with Dr. Durst's custom program with her Votiva, that she's been able to evolve on her own through her tons of patients that she's treated, she's been able to develop her own protocol that is highly effective.
Yeah. And we actually, so when we go onto the outside, it's amazing because a lot of women won't want to take pictures on the outside, and we want to take pictures, and of course we keep them as part of the medical record, and they never have to look at them if they don't want to. I'm kind of surprised at how many people don't want them, but we do encourage it. And so I would say, 99.9% of our patients will actually get the pictures before. And by the third treatment, they want to see the pre-pictures in the post, because there's an amazing difference in tightening on the outside. So again, we go to the outside because we can hit the clitoris that way. You can actually hit, the clitoris, even what we consider the legs of the clitoris that come down on both sides, but also tighten the labia minora and majora with that as well. And so they love to see after pictures because they notice a difference, even with the first treatment. And so that's why we spend so much time, and we can focus in on the outside. And the clitoris needs to be included. It's strictly a sexual organ. So again, if we're only doing vaginal and G-spot inside and like the vaginal canal, we'd like to come out and make sure that we're addressing any cosmetic concerns they may have, and then clitoral stimulation as well. Because again, as we age, that's a big complaint with women in perimenopause and menopause, is that they'll have orgasmic sensitivity decrease, and it takes them longer. And they absolutely love the Votiva O-shot combinations. And I will say almost all of our patients do the combination. The only time that we will have a patient that doesn't is because they come in asking for the O-shot, and they're pretty hung up on the O-shot. And that's when I offer that kind of special, like, listen, it's worth trying Votiva. And we priced it so that they try Votiva with their O-shot, even though they really want an O-shot. And then they end up coming back and buying the series most of the time because they love the two in combination. But tell me this, so the only time I really truly will proceed just with an O-shot is really if it's a vaginismus. Somebody might have some pain that I don't think is a lubrication and dryness or vaginal health. I think it's more of a muscular contraction, or have had no children and are relatively young, and they just want maybe orgasmic sensitivity, that's better. Those are the only times that I don't and haven't done Votiva. What are your thoughts on those two conditions and doing Votiva with them?
If there's no degradation in the quality of tissue, or if there's no laxity, if it's just literally, of course there can be psychological things as well that have to do, with orgasmic function, with women. So, you would definitely know best, but I would say that, it's all about, being completely open and honest with your provider,
Mm-hmm.
and, covering every single aspect of what you're dealing with and not holding anything back. And like I said, things were taboo about this not too long ago. And, things have changed, in the past 5 to 10 years, and every aspect of these, services that are not traditional medicine, but yet fall directly into your scope of practice. These patients, need a customized approach. And so, if patients don't have, significant laxity, if they're not having, incontinence, if they, don't have dryness and dyspareunia, or, significantly painful intercourse, and it might just be just needing to enhance, like you said, the G spot, or, utilizing those other approaches like, the O shot, just to deliver that, just to maybe start out with, and then go from there.
And again, it was taboo. I find that, like, we don't see that in our office that often, but maybe it's because we're not that office. And so we're okay having those conversations. And again, not just conversations that are going to give you just, a solution and you're out the door. We're constantly in contact with our patients. If they're perimenopause, menopause, we're addressing hormones. We can address vaginal health in lots of different ways. And Votiva and O-Shot are one of them. We'll add peptides in. So I like to offer them comprehensive solutions, and they just don't get a lot of that elsewhere. And so, hopefully we can get the word out there more. And I know there's lots of OBGYN doctors that have Votivas in their office, but I'm not sure how often they're actually turning those on and using them. And frequently it's because, again, I think it's just that traditional mindset and switching to something that they might have to, pay for in a different way. But it's worth it. And it's definitely offers you better solutions than medications and surgeries do.
Oh, yeah, absolutely. The spectrum in just the past 5 years alone from the spectrum has shifted away from, surgical approaches and these kind of things, just, strictly because of the kind of complications that can arise when you're trying to treat these issues. And a surgeon cannot guarantee that it's going to fix the issue. So, it can be a very costly, these other options, these surgical procedures can be very costly. They can be dangerous, and there's no guarantee that it works. So this really should be the first form of therapy for a patient that hasn't just let it all go. There's of course always going to be a cutoff where non-invasive procedures just won't cure the issue. If you have a 85-year-old patient that just hasn't done anything for corrective measures, and then all of a sudden it's just like completely falling apart, then you gotta take the proper measures to get the therapy, to get the treatment, so you're not suffering in silence. That's the main thing. A lot of women think that this is just all part of childbirth or all part of aging. And just like we've proven with lasers and radiofrequency and injectables and fillers on the face, neck, and body, that we can reverse the signs of aging. We can add youth back to the skin. You just have to abide by the protocol. And now with Votiva, we're just taking that approach, to this incredibly important area of a patient's life. I mean, from the sexual side, from the wellness side, from the quality of life side, it's the main thing. Just don't suffer in silence, because there are therapies like this that Dr. Durst offers that will literally change your life. I mean, I've now, sold Votiva now for a little over 4 years, and there's no one that has ever come back to us and said, "Oh, I'm not happy with Votiva." Like, everyone loves it, the patient rapport, and then them coming back and sharing their quality of life stories and how it's changed their marriage and changed everything about their lives. It's something that I like to shout from the mountaintops, because it's something incredible. It really is.
We have not had one patient ever come back and complain about Votiva. No. In fact, though, that offering to kind of get them away from just the O-Shot, since they've Googled O-Shot, they've learned about it, they want an O-Shot, they work so well in combination that most of those patients, I would say 99% of them, come back and do the whole series because they love the Votiva treatment with it. And again, if they have urinary incontinence, vaginal dryness, which is really a blood flow issue, and so increasing blood flow to the vaginal canal with Votiva. And again, we pair everything with at least one O shot, but a series of Votiva, at least 3. And there's really no limit to what you can do to improve. And again, I do think patient satisfaction or patient selection is key, but really it'd have to be almost, like a Vagisil, Rectisil, where they have something protruding out. Because otherwise, yes, they need to be hormonally balanced before we do the treatments, to get them a little healthier so that then we're heating a healthier vaginal canal.
Right. And even if with those patients, I mean, I've seen, Rectisil, those kind of patients be somewhat reverted back to normalcy without having surgery. And even if you are going to have surgery on those areas, if you just, like I said, one of those patients that have done nothing, to help the cause up until now, and it's just, debilitating, then still, if you're going to do surgery, you have to do surgery, then if you use the radio frequency to increase the quality of the tissue and the blood flow to the area, then the surgery is going to heal faster and better, bottom line, if you have healthier tissue. So in any way, it would be a great therapy no matter what direction the patient's going to go.
Well, Votiva and O-shot combination and female sexual wellness is in a way, one of my favorite, areas of medicine. And I think it has been taboo for too long. I do feel like that's getting better. And I feel like, again, women tend to suffer in silence, as you say, because it's not out there. Nobody knows, but it is hard to hide pain. And so once it gets painful, then they tend to address it, but they don't have to have urinary incontinence. There's ways to non-surgically correct orgasmic strength that as it decreases either perimenopause, menopause, or just from childbirth. You don't have to have that happen. There's no limit to really what you can do as far as Votiva, because it doesn't have to be a series of 3. It can be a 4th, a 5th, a repeat, the series of 3. You just need to, wait the appropriate times, and then O-shots again. In addition, I love Votiva, heating the vaginal canal, telling it it's injured, getting all the repair mechanisms going, and then throwing a bunch of growth factors in there with an O-shot is a great combination.
And I want to stress that, that an ideal candidate, you don't have to be, postmenopausal. I have friends who have sent their wives, they've had 2, 3, sometimes just one kid. And it wasn't like there was just debilitating issues, but there were just underlying issues that they were just dealing with. Everything from orgasmic function to just daily life and incontinence. And a 33-year-old, one of my coworkers, wives, 33 years old, completely changed her life. She was just suffering. She had two children, suffering from a lot of those underlying conditions. And orgasmic function as well. And he just, he didn't get in any detail, but he was just like, it changed. You can, there's a very noticeable change from both parties just after, she's only had 2 of the 3 treatments. We were just talking about this last week. So, it's not just for, the older population. It really is for any woman suffering from these conditions. Whether you're 25 and you're, all of a sudden you sneeze and you wet yourself, or you're just not having the same kind of orgasmic function as prior to whatever has happened in your life cycle. But it's just all about talking to Dr. Durst, talking to a provider, finding out the issues, and getting a prescribed therapeutic approach.
Well, and I think the issue is that now the younger, just as in aesthetics, right? They're better about collagen building, doing like a forma treatment and staying up on collagen, elastin, microneedling, doing all their things. And so when they have children, and again, having children is a beautiful thing, but it can take a toll on a body. And so they don't have to have those mild changes. And in fact, getting on top of those early just prevent progression of that.
Yeah, absolutely.
With another child or, with just further aging. And so, it doesn't have to be severe by any means.
Yeah. And if you look at, injectables and Botox, if you catch wrinkles early at 32 years old, and then you can maintain a wrinkle-free forehead till you're 60. But if you wait till you're 55 and you start trying to put Botox in your forehead, you're going to need a lot more therapy and a lot more treatment, a lot more different approaches to be able to try to iron out that skin and plump it back up, as compared to if you would have use preventative maintenance. So it is, and I don't know, Dr. Durst, if you could just talk briefly about, maintenance with Votiva and what your thoughts are on that.
So usually once we get through a series, the typical series is a series of 3 with an O shot on the first one. Occasionally there'll be a person that doesn't have improvement of incontinence, or sorry, not improvement. They all have improvement but with an O shot alone, I would see some that would need a second or a third. But now with Votiva, all of them get improvement, but maybe not to the level they want, depending on the severity when they come in. So we may do another O shot or another Votiva and add on to that series. Once we get them to where they want to be, then usually at least a yearly maintenance. And usually that entails both an O shot and a Votiva.
Awesome. Yep. Sounds about right.
Yep. And so you're doing that at least once a year. And again, what I love about, our office is we can address hormones from a menopause standpoint. So comprehensively get their hormones balanced, their vaginal health is good, and then we can regenerate on a local issue when they have it, because they need both until they get to the point where they're happy. And then we move them on to maintenance as far as local regeneration. Do you girls have any, they get a lot of calls. So, and anything specifically you want to ask Kit while he's still on the phone?
So
on the Zoom?
Samantha and I do a lot of the leads that come into the office, and we typically get asked about the Mona Lisa. Can you tell us what the difference is between the Mona Lisa and the Votiva?
Yeah. So actually, when I was talking about the first technology that I helped bring to market, that was the Mona Lisa. Mm-hmm. There was another laser that's identical that was used first, but really the Mona Lisa was the first one to come to the States and start to build a market presence and really prove that this is a very viable therapy using energy to cause a thermal reaction and heal the tissue. So Mona Lisa, that was the first generation of technologies. It's kind of like comparing the first generation of cell phones to what we have now. Mm-hmm. It's a laser, and lasers, from a broad spectrum. I mean, lasers still sound super futuristic, but they're kind of outdated now in the world of medicine. And I mean, in some ways, they're very still good for cutting using thermal coagulation to stop bleeding and things like that with a laser. But as far as causing a change in the tissue with the Mona Lisa, it's a fractional CO2 laser, and so it uses amplified light to burn the tissue in a grid dot format, and essentially what that causes is a burn, a crater, a thermal crater that burns the tissue in the mucosa, and since it's in a dot grid pattern, it just leaves healthy tissue around every single burn. And so not all the tissue is compromised, and then it heals and it just brings in new tissue and new collagen and elastin. The problem with lasers is that it needs a target. Lasers either need a color or they need a liquid as a target. And with the Mona Lisa, with the CO2 laser, its target is water. The vaginal tissue is enriched with water. The mucosa is comprised, of course, mainly of water, just like our gums are. So as soon as that laser hits the tissue, the vaginal tissue, it dissipates immediately. So it causes a very superficial burn crater, which, of course, as soon as you burn tissue, it's very compromised. So you have an increased risk of things. You have open wounds, essentially, thousands of them inside the vaginal tissue. So with Votiva, you fast forward. So we knew, these scientists and physicists realized, hey, you don't need to burn the tissue, the vaginal tissue, to cause the same anatomic change. And as a matter of fact, if you just bulk heat to that 42 degrees Celsius sustained temperature, the heat, the thermal spread can go way deeper than a laser can. So with a laser, it just a nanosecond pulse, and it burns really quick, and it just leaves a tiny little superficial crater. So it could never get down into the middle layer. A laser, it's just going very superficial on the top layer of the tissue. So would never get down deep enough into the lamina propria, which is the middle layer, and especially not the musculature, to cause that musculature change and the physiologic change to be able to contract, control stress, incontinence, its orgasmic function, things like that. So very superficial treatment with Mona Lisa. Now fast forward to Votiva, it doesn't burn. It bulk heats uniformly and sends that energy down 10 to 15 times deeper than a laser can, very uniform and controlled. There's no reported risk of complication because you're not burning the patient. And so you have a very uniform therapeutic treatment that's registered and on label as this therapeutic treatment, while Mona Lisa is completely off label. It's not even registered as an intravaginal device. The CO2 laser that it uses, that is what the tower is, was actually just for epidermal and general dermatologic, gynecologic chain procedures. So it was never made for an intravaginal approach, but they used it anyway. So that's when the FDA came down and they were like, hey, all these companies are manufacturing these intravaginal devices, and most of these companies don't even have the indication to do so. So a lot of companies are either shut down on making those devices, or they have to change a lot of their literature and things like that. And so it really it changed the industry a lot. So the great thing is that it really put Votiva on top, because as we discussed earlier, it's as on label and therapeutically indicated as it gets, while everything else is not at all. So it's the evolution of technology, as we've seen from the flip phone to the iPhone of today. It's all controlled by artificial intelligence. The heat that's being generated and sent into the tissue is being monitored 1,000 times per second by the machine, while the lasers don't do that. So it's just continuous bulk heating that's very therapeutic, that's very safe, and it's tolerable. I mean, it's comforting from what I understand. So it's not a painful treatment at all. While the Mona Lisa touch, if you can imagine, you have a laser that's burning the internal vaginal canal, it's not going to be enjoyable. While bulk heating at a therapeutic temperature is actually very comforting. So it's in every single way, from the efficacy, from the depth of penetration, from the indications that it can treat, from the registration through the FDA. Votiva is just a completely evolved technology as compared to the Mona Lisa touch and other technologies previously before this came to the market.
And you had some downtime with it. So if you're burning, there's obviously, because patients will ask that frequently as well with, just the bulk heating, which I don't limit their downtime. Again, downtime is a relative term, right?
Right.
Whether we want to use downtime or just like just like the outside, you might get a little redness or soreness. If that's the case, then obviously you want to avoid things. But again, even on the outside with Votiva, we're doing Forma on the face, to stimulate collagen and elastin and prevent, and microneedle. And you can actually do Morpheus on the outside too, to stimulate collagen, elastin, and build volume to the labia majora. So there's some things you can do that likewise, the perineum and the external area for women, it's a maintenance, like it's a preventative, just like the face, just like the neck. And so it's not something that anybody should be afraid to talk about or want to see. Just there's no reason why we shouldn't regenerate any area. And so again, we go into neck, hands, and chest when we're doing face. So going to the outside when we're doing regenerative areas vaginally is just the right approach, right next step. Juliet is the same, right? It wasn't a CO2, but it's an ablative.
Right. It was an erbium.
Okay.
Yeah, it is ablative. So it's just two different wavelengths, but the same concept.
Okay.
Mm-hmm.
All right. Good enough. Yeah.
I guess my question is there any contraindications, like a pacemaker or anything that you can't do this treatment if you have?
Yes. So, of course, pregnant and breastfeeding is a contraindication. Exposed vaginal mesh, as we were talking about, the complications from previous surgical procedures like intravaginal mesh placement that can erode and cause complications. So if there's exposed mesh, then you're really not supposed to treat. I've heard of providers doing so otherwise, but of course, that's discretionary. As far as the pacemaker is concerned, from InMode's perspective, on paper, it is a contraindication. Any kind of electrical implant is. I will say, though, this is bipolar radiofrequency, so it's all contained at the distal end, or at the end of the handpiece. So there's no energy free flowing through the body. It's very contained and uniform and very safe. So from the company's perspective, it is a contraindication for a pacemaker. But it's all discretionary to the provider. And there's just, like an active herpes outbreak would be another contraindication. Just minimal things that are pretty few and far between. It's pretty broad as far as what a patient can be treated for with it.
Thank you so much, Kit, for being with us today. It's valuable information, and I love when we can get that information out to more patients. So
it's my pleasure. Thank you for having me on. I will say, Dr. Durst is one of the most advanced Votiva providers in the entire country. She has some of the most experience with the technology. So you'd be in great hands, seeing her and getting her expertise on your conditions. So I appreciate you having me on. It's my pleasure taking the time to share what I know about it, and
awesome.
Be happy to get on here again. You just let me know.
Yeah, well, we might choose like a different topic. It sounds like, again, one of the hot trending treatments of the year 2021 is Morpheus and RF microneedling. So maybe we'll do a whole nother segment on that. What do you think?
That'd be great. I'd love that.
All right. It's one of our favorites as well. So in the aesthetic realm, of course, although we have done a couple on the Votiva and the Morpheus. And so I must say that when we're down there and we're discussing concerns, we have done that and added Morpheus onto the treatment. So
it definitely helps a lot with texture, tightening, and everything else. And yeah, Morpheus is now, as of last month, the most Google searched energy-based skin treatment in the country. So it is by far and away the most effective skin treatment, and it's really, once again, the next generation of fractional skin treatments, and you don't have to burn the skin in order to cause a much more significant change. So once again, really another evolutionary step in technology brought to you by the most advanced company in the space.
I know. I love it. I love it. We were just recently in Atlanta at one of their wonderful growth conferences. So we learned a lot more down there. So definitely, awesome. I think we'll plan that so we can talk about the hottest treatment for 2021, Morpheus.
Sounds great.
Again, thank you for joining RevMD Sex Bites today. I want you to like, subscribe, and hit the bell. Definitely share with friends so we can get this information out to more people. I want to hear anything you want to talk about. So please place anything in the comments that you might want to hear in the future. And likewise, if you have any experience with vaginal rejuvenation, the O-shot, or any of the laser RF devices we talked about, please let us know your experience. I would love to hear about it. And again, if you're a provider that is maybe thinking about adding a vaginal rejuvenation device to your practice, or whether you have one and maybe just aren't using it as often as we are, please reach out to me so that I can help you make this part of your daily practice. Because again, sometimes it's hard to switch over from, more traditional mindset to a regenerative treatment and services. And so we can help you do that. The office is awesome at educating patients. And again, we do these services on a daily basis. So again, let us know if there's anything you want to hear about. And we're here to revitalize your look, your health, and your sex life, and willing to deep dive into any of those. Thank you.